Hello, my name is Dr. Warren Chin. I'm a family practitioner and specialist in osteopathic medicine in New Hampshire. I want to talk to you today about thoracic outlet syndrome, and it's very commonly found in a general practice, which includes family practice, emergency room medicine, and internal medicine. And the symptoms that patients come in with complaints of arm pain and pain in their neck, pain in their shoulder, and it can be the result of many causes. The pain can also cause tingling and numbness in the fingers and hand as well as it gets more progressed. Now, what causes thoracic outlet syndrome? When we have a rib on the top of our rib cage called the first rib, it actually attaches at the base of the neck, covers the top of the rib cage, and it is essentially our first rib. Now, in very rare cases, 1 in 500 to 1 in 1,000 people have what they call a cervical rib, which is a little riblet above that first rib that attaches to the bottom of the sixth rib. Now that can cause problems too. Why? Because when people do certain things, usually with their hand overhead, if they pull something from overhead that's heavy and they're using just one hand, or they could be talking on the phone like this all the time, or they could be sleeping on a sofa using the armrest as their pillow. They could be on a plane and they can fall asleep and get turbulence, and that can throw it out. Now, what happens at that point? The rib can actually pop out of its socket at the base of that seventh cervical vertebrae of the neck, and what happens is the muscles in your neck and shoulder, which are the scalenes and the platysmus, they can actually spasm because of the nerve irritation and pull it up. Now, if it pulls it out of the socket, the problem is that you can't, it can't go back in by itself. Now, the problem with that is that it does press on nerves. The nerves that go down your arm, called the brachial plexus, they are made of nerves that come from the middle of the neck down to the upper back. Now, those nerves come together as a conduit that goes down your arm as the brachial plexus, or the nerve to your arm. Now, when that happens, you get all kinds of symptoms. You get, when you lie on this side or when you raise the arm up, you can get pain in the shoulder, tingling down the arm. You can also get pain just in the shoulder. In fact, the pain usually starts as a pain right where the neck connects to the upper torso. That's where it starts. And as the nerve, the brachial plexus gets pinched, it starts affecting all the other sections, including the upper back and the lower neck. Now, if you look in Up to Date, which is a clinical reference used a lot by doctors, they say that it's fairly common and that it occurs more in women, and that it is amenable to treatment with just physical therapy, heat, analgesics, and anti-inflammatories. Now, if you have vascular compromise, if your fingers start turning blue, or if you have intense pain with that blocking off of the blood vessels, then you would need to investigate further. You need to do a scan of the blood vessels to make sure there's not a blood clot. Now, if that isn't there, then you have to assume that the first rib is really pressing hard on that brachial plexus and also the structures of the blood vessels that are going down your arm. In that case, a lot of doctors advocate surgical removal of the first rib. Now, the simple truth of it is, if you can just simply move it back down using some form of manipulation, I prefer osteopathic manipulation, and I do have a maneuver that takes only 3 seconds and is totally painless to perform, that can actually fix and alleviate all the symptoms of first rib syndrome, or what they call thoracic outlet syndrome. The technique I have is in the member section, and people who are osteopathic physicians or students or MDs that know palpation can use this very simple manipulation to help a lot of their patients. And the neat thing is, the pain goes away instantly, and it doesn't go back unless they redo the injury itself. And what we usually do is tell them not to reach overhead for the next day or so. And then by then the articulation will get further in place and